That's a great question. And honestly, one that we are, if you're successful in the long term, I hope we make a small dent in that statistic. So let's just take a step back and think about it from a bigger picture standpoint. So a median physician today is 54 years old, or the median age of a practicing physician is 54 years old, which means that half of them are going to leave medicine in the next decade. Okay, that's about 400,000 physicians that we're going to lose over the next decade. We can only add about 30 to 35,000 new physicians into the workforce. That's basically the residency pipeline we have, right? For a wide variety of regulatory reasons, it is difficult for us to increase the number of residency slots that exist out there, right? So you cannot increase the supply of physicians. And meanwhile, we are sitting on a shortage of about 86,000 physicians over the next decade. So given all that context, the only lever we have to be able to address the shortage is by increasing the longevity of physicians practicing medicine. There are stats out there that say that most physicians, a median physician leaves clinical practice after 12 years in practice, right? And that number has gotten a lot worse over the last decade or two. And so if we can just make it easier for physicians to be able to practice medicine for a few more years, that is going to have a significant impact on on helping us address this shortage. And that is really the mission behind Merit. And I think the way we do that is by helping physicians find the best places to work at, help them design the right work structure, help them feel more successful in their career so that they don't think about, leaving medicine so fast. Most of them are burnt out. So I think we hear statistics around there's like so much administrative overhead, in the practice of medicine that physicians feel burnt out. Most physicians will tell you that they have lost autonomy and empowerment because, again, they feel like they're just workers at a large health system. Physician pay, as I mentioned, is largely set by CMS, based on the CPT codes that they can bill that directly or indirectly impacts, what physicians get paid. And so there's a wide variety of reasons why physicians feel like, practicing medicine is just a lot harder and not as fulfilling as it used to be in the past, right? And so it's going to take a wide variety of efforts to try to bring that autonomy and empowerment back, right? Our thesis is that if you can bring this community together, if you can give them access to all of the resources, if you can bring transparency to this profession, that is one way we can help clinicians, feel more successful and help them bring the joy to practice medicine. It's going to take a lot more efforts from others as well, ultimately. I think physician recruitment might be one of the very few professions left in the US workforce where it's still so old school and done so manually. So the state of the art for physician recruitment today is as follows. The large majority of that happens through third-party agencies. Within that, the bulk of recruitment is happening by people manually calling and texting physicians, presenting them opportunities. An average physician, my co-founder, Dr. Rob Anderson, would say he probably gets about 5 to 10 text messages every single day. He's an anesthesiologist. We have a huge shortage of anesthesiologists in the country. And so every anesthesiology feels like they are being hunted by recruiters every single day. That's how we're trying to recruit the most advanced knowledge workers in this country, right? And so now we are living in the world of AI, and what AI is really good at is by creating an extremely personalized experience for everyone, right? And so we are modernizing physician recruitment the way I think other industries have already done it over the last decade. And so the way Merit works is that we try to understand from every clinician what their needs and preferences are, what kind of locations they prefer, what kind of shifts and schedules they feel like they can sustain, in their life, any kind of compensation needs. On the other hand, we try to understand from employers and jobs what their needs and requirements are, And then AI is actually incredibly good now at matching the two sides of the marketplace, right? So if we can figure out what clinicians want, and if we can figure out what employers want, then we can match both sides and create a much more efficient, elegant, and respectful experience for both recruiters and physicians. I think AI offers us an opportunity to rethink recruiting. Recruiting at the end of the day is a human problem, right? Most physicians are setting roots in the community when they take on a new role, and they're going to raise their families over there. They're going to make a decision for the next decade or more, right? And so fundamentally, there is the best job, the best employer, and the best community for every physician. And AI offers us an opportunity to find the best person for the best role, right? So it's not a numbers game. The way you find the best physician is not by sending thousands or tens of thousands of messages to everyone and hoping that someone responds to it. The best way to hire is to actually find the right person for that role and reach out to them and present to them in a very personable way. And that is the opportunity that's ahead of us. And it is actually possible now with AI. And that's exactly how we're trying to solve this problem. There are 1.5 million clinicians in the country between physicians and APPs. And so as exciting as it is for us to reach 100,000 users, that's less than 10% of the users on the platform, right? So we still have a long way to go. Building a career is a lot more than finding your first job and negotiating your first offer, right? Like we want to help physicians understand, what it's like to do a side gig or set up a private practice or manage the hundreds of other things they're going to be doing over their careers. And so there's so much more that we are excited to build and bring together in our mission to bringing all of the tools and resources for physicians in one place. We have a small and fast growing but extremely diverse community of clinicians. This includes practicing physicians, residents and fellows, practicing APPs and trainees. We have clinicians all over the country across all specialties. So we're very proud of the diversity of the community we have on the platform, and we are looking forward to continue to grow that. So we're approaching this problem in a very unique fashion that is not something that this industry has seen before. So this idea that a physician can join on Merit and get access to all of these tools and resources completely free of charge is unique. There's no other service that exists out there for people to get access to all this wealth of data completely free of charge. But Merit is always going to be free for our users because we believe that knowing whether you're fairly paid is a universal need and a universal right, and it's squarely in our mission, and so we'll always make that information available and accessible to them. And then the question that often comes up is like, how do you make money? How do you monetize this? And so our core business model then is to present the best opportunities to these clinicians so that when the right match arises, they'll apply to those roles, and then we monetize it by employers sponsoring their jobs on Merit. And so I just wanted to explain a little bit how our business model works so that, for anyone that has doubt why Merit is free, the reason it's free is because we want to build the largest data set and community in medicine. And the way we then monetize it is by matching the best job opportunity with the best clinician.